So, a lot of people will ask, who is aqua therapy for? And I would say generally everyone, but I do have my own biases. In all reality, aqua therapy is most suited for patients who have difficulty with performing therapy on land. So this can be things where you have a surgery with a weight-bearing restriction, you have a fear of falling that is so great that we can't really adequately manage that on land, or for example, you simply just like being in the water and it's something that we can employ to just better get outcomes. So really treating the pool as a piece of equipment adjunct to the therapy that you're receiving. So in terms of aqua therapy with PT one-on-one versus a group setting or like a group water aerobics class, one thing that we can really emphasize in PT more than the group class is that one-on-one approach, where we can more specifically address goals and needs around balance, strength, endurance, and really less about having that community involvement that we know is beneficial, but also using the pool as just another piece of equipment in PT. So it is still a PT session, and I think that really can help myself and other patients really thinking about the pool as equipment, not necessarily just as like a setting. So in terms of frequency for aqua therapy, it does depend on where you're at in your plan of care. So typically we will start people off with just maybe 1 or 2 sessions a week to see how the pool is tolerated. Clearly being in water is different than dry land, and one of the things that we do like to monitor in the beginning is how your body responds to being in water for a long period of time. For example, the pressure it exerts on our legs can increase the amount of fluid that comes out of our legs, and overall, it can be harder than on land. So in the beginning, maybe 1 or 2 times a week, but it is something that we can progress to just that normal plan of care frequency where it's maybe 3 to 4 times a week is totally appropriate for the aqua setting. One of the benefits of doing physical therapy with clinicians who have had continuing education in the aqua setting is, although while we do graduate as generalists, there are many considerations and evolving research around aquatic therapy. Specifically, in my case, I learned a lot about neurological diagnoses before coming back to the pool and treating more patients.